Is preimplantation, genetic diagnosis ethical for CF? Imagine being able to choose the healthiest possible baby before pregnancy even begins. That's what preimplantation genetic diagnosis, or PGD, offers to couples at risk of passing on cystic fibrosis. CF is a serious genetic disease that affects the lungs and digestive system, often shortening life expectancy and reducing quality of life. Because it's caused by mutations in a specific gene, PGD can test embryos created through in vitro fertilization before they are implanted into the mother. This means only embryos without CF mutations are selected, helping families avoid passing on this challenging condition. Many experts see PGD as ethically acceptable for CF because it respects reproductive choices and offers a proactive way to prevent the disease. It's especially supported because CF is severe, with early onset and no current cure. Using PGD allows couples to have a child free from CF without needing to consider pregnancy termination if the fetus is affected. This aligns with the principle of reproductive autonomy, giving families more control over their future children's health. Clinical guidelines recognize PGD as a valid option for couples at risk of passing on CF. It's widely used around the world, though protocols are still evolving. Genetic counseling is essential to help couples understand the process, risks, and limitations of PGD. It's important to remember that PGD is not perfect. False positives or negatives can happen, so follow-up prenatal testing is often recommended to confirm results. However, there are ethical concerns to consider. PGD can be costly and may not be accessible to everyone, raising questions about fairness and resource distribution. Some worry about how the use of PGD might influence social attitudes toward people living with CF or other genetic conditions. There's also the psychological impact on families, who might face difficult decisions or feelings of guilt. Regulatory oversight varies by country, and guidelines emphasize careful evaluation of the seriousness of the condition and the risks involved. In summary, from a medical and ethical standpoint, PGD for cystic fibrosis is generally considered justified because it helps prevent a serious disease and supports informed reproductive choices. Still, each family's decision should be made with thorough genetic counseling and awareness of the social and ethical complexities. It's always best to discuss options with healthcare professionals who can provide personalized guidance based on individual circumstances.